Chances are that either you or someone you know is dealing with anxiety. It is absolutely deliberating. It can affect so many aspects of your life, your personal life, your work life, every single aspect of you. And I'm pretty sure that you or the person that you know has tried absolutely everything. Well, I'm here to talk to you about the link with exercise and anxiety. If exercise came in a pill to treat anxiety, I think it would be the most wanted pill in the world. Let's get into it. Today, I'm going to talk about exercise and anxiety, the link. I'm going to talk about how exercise relieves anxiety, the science behind it. And then I'm going to give you simple, savvy, sustainable tips that you can implement right now to ensure that you have your anxiety on track. It's Mondays with Mihaela. That's right, me. Thank you so much for tuning in. I absolutely love, and appreciate your support. Absolutely love it. For any of you who this is your first time on the podcast, on the YouTube channel, my name is Mihaela and I'm a qualified naturopath, and I'm here to provide you simple, savvy, sustainable health hacks to optimize your health. And I'm absolutely passionate about all things health, business, and overall success. And that's why today I'm going to be talking about anxiety. A number of us deal with anxiety, if not every day. We have our moments, we have our months, we have our weeks where anxiety creeps up. There it is, hello, and we have to deal with it. And unfortunately, there's not many treatments or therapies out there for anxiety that are successful. But I'm here to talk to you about exercise and the science behind it, of how successful exercise can be to help out with your anxiety. Okay, so when we think about it, anxiety and exercise, the two don't really match. I mean, when you're anxious, the last thing you want to do is go for a run. You just kind of want to be left alone. Isn't that right? Well, let's look into it. So the Department of Health and Human Services in the US did a report on physical activity, and they found out that regular exercise significantly reduces all-cause mortality by 30%. That is crazy. In addition to significantly lowering causes of mortality, so including to that, regular exercise also lowers chronic disease. Numerous epidemiological studies have shown that exercise improves one's self-esteem and a sense of well-being. Okay, so there we have it. It helps out with mortality, with your self-esteem, with chronic disease. But what's the link with anxiety? Okay, and this is a huge one. Okay, in 2019, a meta-analysis concluded that physical activity can protect against the emergence of anxiety regardless of demographic factors. This was a huge study that came out last year, and essentially what it is saying is that exercise can assist and will assist with your anxiety no matter what your demographic factors are, because these usually are an issue in regards to studies, because some people do better due to the demographics. But this is saying no matter what your demographics are or demographic factors, your exercise can help you with stress. Exercise can help you with stress, of course, but also with anxiety. Okay, so let's look at the link. Okay, exercise and anxiety. So let's look at what is anxiety. According to the DSM-5, which is the Diagnostic and Statistical Manual for Mental Disorders, what psychologists, psychiatrists use to define anxiety. Okay, the first thing is excessive anxiety and worry occurring more days than not for at least 6 months about a number of events or activities such as school, work, and so forth. The individual finds it difficult to control the worry. The anxiety and worry are associated with 3 or more of the following 6 symptoms, so the ones that I'm about to name. Restlessness, feeling keyed up or on edge. being easily fatigued, difficulty concentrating or mind going blank, irritable, muscle tension, sleep disturbance. Okay, so you have to have 3 of those at minimum. The anxiety, worry, or physical symptoms caused clinically significant distress or impairment in social, occupational, or other important areas of functioning. The disturbance is not attributed to the physiological effects of a substance such as drug abuse, medication, or another medical condition such as, for example, hypothyroidism. And then the last one is the disturbance is not better explained by another medical disorder. So those are some of the, so that is essentially the clinical definition of anxiety. And just reading some of that, a lot of people don't actually get diagnosed with anxiety, but just reading some of them, you're probably going, yep, that's me, or yep, that's someone I know. So that you don't have to be clinically diagnosed, but those are the symptoms that are there. Okay, so anxiety disorders is a common psychiatric condition with a lifetime prevalence of nearly 29% in the United States. Here in Australia, anxiety disorder is the most common of mental health conditions in Australia, and it affects 1 in 4 Australians at some stage in their life. That is crazy. That's 25% of individuals here in Australia. As that anxiety can affect your ability to concentrate, sleep, carry out ordinary tasks at work, home, and schools. People with anxiety disorders often feel they have to avoid stressful situations because they're unable to deal with them. And in extreme cases, avoiding going out all together. So they wouldn't want to go out anywhere due to the anxiety that's coming up. Physical symptoms are common and include shortness of breath, pounding heart rate, trembling hands, sweating. Well, you know, when you've got anxiety, everyone's different and their effects are totally different. But these are some of them, what happens when you have it. And when you have them, the last thing you want to do is be out there and socializing or being happy or being out there. You just want to be at home, stuck inside, not doing anything. So here are some statistics that actually got published in 2013. I know it's a bit old, but we can kind of look at what was happening and it can just probably go up even more. So, and this was done in the Medical Journal of Australia. Okay, so about 85% of patients with depression have significant anxiety, and 90% of patients with anxiety have depression. So anxiety and depression are interlinked together. Okay. In Australia, in 12 months, prevalence of anxiety disorder is 14%. I'm sure this has risen by then. The most prevalent anxiety disorder in Australia are post-traumatic stress disorder, taking 6.4%, social phobia, which is social anxiety disorder, which is 4.7%, agoraphobia, which is 2.8%, GAD, which is 2.7%, panic disorder, 2.6%, and obsessive compulsive disorder, 1.9%. All those are parts of anxiety that go in deeper. But we can see that one of the key ones is post-traumatic stress disorder and then social anxiety. I believe with everything that's happened currently in the world, that social anxiety is going to be on the rise, unfortunately. And this is why it's important to look at what can be done. This is why I'm taking out my time to give you this video. Anxiety risks. So when having anxiety, you don't just have anxiety. When you have anxiety, you have higher risk of getting cardiovascular disease, you have higher risk of getting hypertension, higher risk of getting diabetes, higher risk of getting any other mental disorders such as depression and so forth. The risk is so much higher to developing other health issues. Okay, so even among healthy individuals, anxiety can be associated with unhealthy behaviors such as physical inactivity, smoking, poor diet, leading to an increased risk of developing other chronic health issues. And this is where the risk lies. It's not just about having anxiety, it's about what will anxiety do for you further. So the gold standard treatment for anxiety disorders is cognitive behavioral therapy, also known as CBT, and pharmacotherapy. Though effective in some individuals, 14 to 43% of anxiety disorders, the treatments, patients do not respond to treatments, and 18 to 48% relapse within 6 months. So even if they take it, even if they do the cognitive behavior therapy or take the pharmaceuticals, they relapse. So half of those suffering, this is an estimate, half of those suffering with anxiety do not initiate or receive adequate treatment. So there's individuals out there who have anxiety and are just not getting treated. So there is a need for consideration of alternative, complementary, or standalone approaches for treatment of anxiety disorders, because we can see that CBT and pharmaceuticals aren't as effective as we want them to be, and are not as effective as we need them to be to have, and not have an anxiety-free society, but have a society where anxiety is not so high and prevalent. So now that you know a bit or a lot about anxiety, let's look at where exercise comes into play and how exercise is able to assist with anxiety. But when we look at it, it's not just assisting with anxiety, it is also assisting with other chronic diseases. Exercise may represent a promising, affordable, and easily accessible treatment option for individuals with anxiety. Exercise is distinguished from other movements because it is planned. It is planned out, time is taken out, and then it is structured, and it is also repeated. A number of observational studies documented an inverse association of exercise and symptoms of anxiety. For example, in one study of 8,098 individuals, regular exercise reduced risk of being diagnosed with an anxiety disorder compared to individuals who were not exercising. That is absolutely huge, and this is why I love looking at other treatment options. Okay, so let's look at how exercise on a biological level may be assisting with anxiety. So what we look at first is my favorite, which is the hypothalamus pituitary adrenal axis, known as the HPA axis, which is so prevalent in stress and is so prevalent in anxiety disorders. Regular exercise results in psychological changes and adaptation in the human body, as we know, because anyone who's exercised feels it. The studies have shown that regular aerobic exercise is associated with lower sympathetic nervous system. What are we trying to do? We are always trying to lower our sympathetic nervous system, especially if we have anxiety or high stress. And this is saying that exercise does it. So the HPA axis plays a crucial role in developing adaptive response to physical and psychological stresses. Dysregulation of the HPA axis have long been implemented in the manifestation of depressive and anxiety symptoms. So by exercising, you are lowering your HPA axis activity, which is a key player in anxiety. So one way is the hypothalamus adrenal axis. The other one is brain-derived neurotrophic factor, neurotropic factor, which is also known as BDNF. And I've spoken about this before. You would have heard me talk about this before, or you would have heard others talk about this before. It's out there at the moment. It's this big new thing. Okay, so brain-derived neurotrophic factor is the most abundant neurotrophin, which is a protein that induces survival, development, and functions of a neuron. In the brain, it has been linked to both anxiety and depression. Okay, so stress-induced anxious behavior is correlated with a decrease of BDNF levels. So the more anxious you are, the lower your BDNF levels are. So furthermore, the BDNF has been shown to have an antidepressant effect, which is huge, absolutely huge. So evidence suggests that the BDNF may be a mediator for anxiety-reducing effects of antidepressant medication. Increases in BDNF following physical activity has also been observed. So this is saying you're exercising, and as you're exercising, your BDNF goes higher, but your BDNF was low because you're anxious. So what is that doing? Amazing, amazing, amazing. So following 20 days of voluntary wheel running compared to non-wheel running rats, BDNF levels increase in the hypothalamus. These changes in BDNF increasing functionings may promote neural growth. So this is absolutely amazing. Another study also looked at that acute aerobic exercise has been shown to significantly increase BDNF levels to normal controls in individuals with psychiatric conditions. So if you don't have anxiety or have anxiety, it's going to increase your BDNF, which is absolutely amazing. So there you have it. So that's the BDNF that can help out in that. So in addition to that, the authors found that patients with panic disorders had significantly reduced BDNF, and we know that panic disorders is a symptom of anxiety. So the author found that with panic disorders had significantly reduced BDNF concentration. So 30 minutes of moderate intensity exercise significantly increased BDNF concentration in these individuals with panic disorders. So that is absolutely amazing. The other one is beta endorphins. We've all heard about endorphins. It just makes me smile thinking about endorphins. Okay, so an increase of endorphins after exercise was first reported 20 years ago, so a while ago, when endorphins emerged as a candidate mechanism to explain why people are becoming addicted to running. They were like, why are people running so much and why are they becoming addicted to it? So what they found out that endorphins is a class of opiate peptides which you become addicted to. So recent studies have shown that an increase in cell proliferation can be produced by the direct infusion of opiates, and the opiate receptors decrease cell proliferation. Opiate receptor antagonists decrease cell proliferations. So what this is saying, the opiate effect that you get from production of endorphins serves your body as a body's reward system. So it's like, thanks for running, you've done an amazing job, here's that amazing feeling. And that's what you get. So besides the feeling of an amazingness after you're running, which you can't really feel amazing and down and anxious, it's one or the other, which means that running is highly beneficial in that. But I'm going to go into that more detail later. So what it does also, besides the feeling of amazingness, that also reduces pain. It's also associated with euphoria, appetite control, secretion of sex hormones, and improved immune response. So these endorphins may originate from any part of your body, such as spinal cords, pituitary gland, and many other areas of your nervous system, which can help and assist with your anxiety. The next one is atrial natriuretic peptide, AandP. I probably pronounced that wrong. I tried my best. I'm going to refer to it as AandP, which is a peptide hormone that inhibits hypothalamic pituitary adrenocortical activity, which may have an anxiolytic property. Okay, so Stuha, which is with this study, showed that both central and peripheral administration of AandP reduced fear responding rats as well as among individuals with panic disorders. So submaximal and maximal exercise bouts significantly increased AandP concentration. So he examined the effects of exercise on AandP and response to panic. Okay, they found out that exercise 30 minutes at 70% of your maximal heart rate significantly increased plasma AandP and reduced anxiety. Importantly, the magnitude of the reduction of anxiety was directly associated with the increased level of AandP. Amazing, absolutely amazing. So now that we looked at how exercise assists with anxiety on a biochemistry level, we can conclude through numerous studies and showing you how it works in our body that exercise assists with anxiety. Individuals who report chronic anxiety frequently engage in strenuous physical activity in efforts to alleviate their symptoms. So one study suggests that both aerobic exercise and strength training improve anxiety when done on a regular basis. The beneficial effects of exercise are similar to those of meditation and regular relaxation. Acute onset of anxiety generally responds better to exercise than long-standing symptoms of anxiety. So this study is saying that us exercising has similar effects to relaxation techniques and meditation, because everyone says, oh, go meditate. But I know a lot of people aren't the meditation type. They can't just sit still. So exercise can have similar impacts for your anxiety, similar to meditation and relaxation techniques. A workout program consisting of at least 20 to 30 minutes daily exercise can significantly reduce symptoms of anxiety. So this is from my 10-week study of exercise in individuals prone to panic attacks. Show regular walking or jogging. This looked at 4 miles 3 times a week, reduce severity and frequency of panic attacks. Wow, we know what panic attacks does to individuals, because you don't go out, you don't do what you want to do because you're scared that you might have a panic attack in front of individuals in society, outside, at work, at school, so you don't do things. And if exercise can help reduce the frequency of panic attacks, if you were getting them 5 times a week to getting them once a week, that is extraordinary and is life-changing. That is amazing. So now the question is, how much do I exercise? Like, do I just exercise 10 minutes, 20 minutes? How much do I exercise to get these effects? Okay, so I found a study that looked into this. So exactly how much exercise does one need to protect against episode of anxiety and anxiety disorder? While pinpointing is not easy, this is what this study says, a recent meta-analysis in a journal, Anxiety Depression, found that people with anxiety disorders who reported high-level physical activities were better protected against developing anxiety symptoms than those who reported low physical activity. It doesn't really mention minutes and stuff like that, but what we talked about earlier was 2 to 2.5 hours, which was set a week, 2 to 2.5 hours a week, which is like 30 minutes 5 times a week. I'm here to tell you that I strongly believe that doing it more days, less, is better than doing 2 hours in one day. Okay, so if you do half an hour, 5 days, Monday to Friday, half an hour, you are going to get those effects. Then doing it 1 hour one day and then not doing anything and then 1 hour the next day. Okay, so do it more frequently. Feel what suits your body. Get in touch with a professional, a personal trainer, or someone who can talk to you in more detail. But these are the effects that exercise can have on your anxiety. So I know you're questioning right now is, well, what type of exercise can be beneficial? Well, I looked into it for you and I've come up with, I think it's three different types of exercises that have been proven to assist with anxiety. Number 1 is yoga. Yoga is an ancient and complex practice that everyone's doing at the moment. It has been spread worldwide from the Indian culture. It began as a spiritual practice, but has become very popular worldwide to help out with mental well-being. A 2011 study published in the International Journal of Yoga, results from this study show that yoga practice enhances muscular strength and body flexibility, promote and improve respiratory and cardiovascular functioning, promoting recovery from and treatment of addiction, reduce stress, anxiety, depression, and chronic pain, improve sleep patterns, enhance overall well-being and quality of life. If someone said to you, here's a pill that does all that, you would take it straight away. But I'm here telling you that yoga helps out with all of these things that I've just mentioned. Also, a recent 2018 study published in the Complementary Therapies in Clinical Practice found that yoga can help reduce depression and anxiety. That's a recent study right there. Number 2 is the practice of Shirin-yoku. I don't know if I pronounced that right. I mean, I can't even pronounce things in English right, yet alone in Japanese. But there you go. So that is a term coined by the Japanese Ministry of Agriculture and Forestry in 1982. What is it? Well, it can be defined as making contact with and taking in the atmosphere of the forest. Many of you have probably heard of forest bathing. This is exactly what it is. So in each experiment, 12 subjects walked in and viewed a forest or a city area. On the first day, 6 subjects were sent to the forest and the other 6 were sent to the city area. On the second day, each group was sent to the area opposites to each other. Salivary cortisol, blood pressure, pulse rate, and heart variability were used to measure to see if it had any effect. So they were measured in the morning and before breakfast, and also before and after they went into the city or into the forest. The results, mind-blowing. The results showed that forest environment promoted lower concentration of cortisol, lower pulse rate, lower blood pressure, greater parasympathetic nerve activity, and lower sympathetic nerve activity. That the forest assisted more, did all that compared to the city environment. These results contribute to the development of research field dedicated to forest medicine, which they are seeing as assisting not just anxiety and depression, but other health conditions. Number 3 is running. Okay, I am not a runner, okay, but lately I have been running, and oh my gosh, I can tell you the benefits I'm feeling. Those endorphins, they are absolutely amazing. And what I mean by running, I'm running twice a week, about 7 Ks each, and it is absolutely amazing. It's assisting with my overall health. So in this study, it's been shown that individuals who have anxiety or depression have a lower synthesis of new neurons, which may be linked to anxiety and depression. So exercises increases the synthesis of new neurons in adult brains, okay? So this is saying that most people who have anxiety and depression lowers their synthesis of new neurons, and exercises increases this, in particular running. A 2 to 3-fold increase in new synthesis has been observed in rats with regular access to a running wheel when they're compared with control animals. This is crazy. This is absolutely amazing. I'm not telling you to run on a wheel like a rat does. Get outside, get the benefits. You know what the benefit is? Imagine running in the forest and then doing a yoga practice afterwards. That's amazing. That's absolutely amazing. So there you have it. I've spoken to you about the link between exercise and anxiety. My final words are: there is strong evidence from studies that exercise and regular activity positively impacts the pathophysiological process of anxiety. Numerous studies and meta-analysis show that exercise is also associated with reduced anxiety. So there you have it. I always say, if exercise came in a pill, everybody would be popping it, because the benefits are just extraordinary, especially with the link of anxiety. So let me know if you like this episode. Do what you do best: like, love, share, rate. Thank you so much. I love and appreciate your support. Share this with someone who you know has anxiety. You may be able to change their life if they hear this episode and then start exercising. Wow, what they can do to their health and to their anxiety is extraordinary. Till next Monday, love you.